We're here with Seth Johnson from Pride Mobility Products and Cara Bachenheimer from Invacare. Seth and Cara, so you obviously been spending a lot of time on the Hill this year lobbying on various issues. I guess what's the atmosphere like there? I mean, obviously a lot going on with healthcare reform in general. What's it been like trying to get in the door and talk to some of these folks about, you know, some of the HME related things that are going on in the industry?
Well, it's true. It's been an unbelievably hectic year. I mean, and our difficulty, as it always is making sure that our voice is heard as loudly as possible. And there's no question there's been more competition, just because everybody in the healthcare industry, insurance, I mean, all the hospitals and physicians, all the big groups are up there and literally have armies of lobbyists. But our challenge, and I think we've done a fair job this year, is just getting our voice heard above the fray, because we've got an incredibly great message, as we always have, in terms of what we bring to the table. We're cost effective, we're patient preferred, we're clinically efficacious. We've got a great message. But,
Seth, just go ahead, yeah.
Cara's absolutely right. We do have a great message, and you know, with healthcare reform being at the forefront as it is this year, we have a real unique opportunity. And lawmakers have been receptive and are very interested in the HME industry. We've talked for many years about how home care is the solution to help, you know, reform the Medicare program and extend the solvency of the Medicare Trust Fund. And legislators are becoming educated and are much more receptive than they've been in the past. And I credit, you know, a lot of the grassroots efforts over the past few years, and certainly, you know, the efforts that took place earlier this year in moving that education and that awareness of the benefit of HME products to legislators on Capitol Hill.
So a little bit more of an understanding what HME is, that type of thing, when you're going in there and talking to them.
I think it's interesting because there's a lot more staff that are just conversant about healthcare issues overall, because they have to be with all the health reform issues going on. And that makes it a little bit easier. You know, traditionally maybe the committee staff were the ones who were really, you know, had the in-depth knowledge, but I think that is really broadening across the Hill, and that's to our benefit. And I think one of the things that we've seen over the health reform is that they really want to know what constituents think. And they need to learn, and they need to understand the details, and they're looking for solutions as much as everybody else. This is not an easy problem to solve, as we know. And if we go in with a constructive message that how we can, you know, be part of the solution, that's great. I mean, we still have our parochial issues, which are very important, you know, power mobility, oxygen, competitive bidding are all in, but they're in the fray too. And I think people are more educated about those because they're more educated in general about all the health issues that are going on.
Is there some pushback when you talk to different legislators or their staffs about various issues? I mean, there's been the Fox, most recently the Fox segment, you know, the CNN report on power wheelchair pricing. Do you ever go in there and you know, do they say, oh, you're the people, you know, that from that Fox, you know, segment? Or I mean, do they associate the industry with that quite a bit? Do they make the connection, or do a lot of people make more out of those things?
I think it really depends on the staff that you're talking to. Clearly the key committee staff, those on the Finance Committee or the Ways and Means Committee or the Energy and Commerce Committee that are intimately involved in the development of healthcare reform, are aware of those news reports and the OIG study. And, you know, AA Home Care does have a response to that. As you know, the OIG report looks at acquisition cost and compares that to Medicare, and there's a lot more services that go into the provision of that equipment that are required specifically by Medicare, that report acknowledges exist, but they don't do anything to quantify the cost of those products. And you know, the Medicare program actually agreed with the industry's position on that and stated that in, you know, they stated that future work is needed by the OIG in this area to look at power wheelchair pricing and incorporate, you know, the cost of those services to provide the entire picture of, you know, what's that pricing model truly look like.
I mean, obviously the industry has champions in you guys. You know, you guys do a lot for the industry and on the different issues. But what can, you know, providers, our readers do, you know, to help, you know, the industry in terms of, you know, lobbying for different positions or fighting against, you know, other provisions? I mean, Cara, you were just talking to a provider here from California.
I've been incredibly impressed this year and also last year with the success we had in delaying the bidding program. The vast majority of the reason for that is because people across the country were motivated at a grassroots level to get their members of Congress involved in the issue and to understand the impact in their local district. And the more, I mean, it's absolutely true, the more the merrier. You know, there's only 535 of them, and there's a lot more of us across the country. It's our collective responsibility to make sure that every single member of Congress understands the impact in their community of what these various initiatives can have. And so I would encourage everybody to, if you haven't been involved, it's really a lot easier than people think. If you have, we need to keep it up and increase it, because I mean, we know the health dollars are limited, and that's the biggest pressure on the federal budget, and this scrutiny is not going to go away.
Seth, have you noticed, have you guys been getting calls from providers who are either, you know, involved or want to figure out, you know, how to help and that type of thing?
Yeah, I mean, there's a lot of interest, and you know, I want to credit HME News for your wonderful reporting to help, you know, spread the word and get the message out how important it is for the industry to get involved in, you know, communicating the impact of these issues that are very real when you look at the development of the healthcare reform bill as it stands. You know, one of the key messages that has been carried and needs to continue to be carried based on the administration's goals for overall healthcare reform are, you know, the Obama administration links healthcare reform to the overall economic recovery. From an industry perspective, one of the talking points that I've been, you know, trying to convey to our providers is, you know, the most important is the impact these changes to the Medicare program are going to have on your business as far as your ability to continue to stay in business. Barack Obama said back in February that he wants to do whatever it takes to help small business, and clearly when you look at the challenges before the HME industry today, they're going to have a negative impact on small businesses. They're also going to have a negative impact on access for consumers to these cost-effective medical products. And I think the industry has done a very good job in getting consumers aware of the impact it will have on them, and having that consumer message complement the overall industry message being carried by providers and manufacturers and clinicians as well.
Great. Thanks, guys. That's good.